Most people assume medical help is always close by, hospitals are open, clinics are available, and emergency services can usually respond quickly. Because of that, many households never think seriously about how they would handle a medical situation on their own, but survivalists think about this differently. For them, the question is simple: what happens if professional help is delayed, unavailable, or too far away? That perspective has led many survival-minded people to study something often overlooked: basic medical care at home. Not because they want to replace doctors, but because they understand that small problems can become serious if no one knows how to respond. The idea behind home medical preparedness is not complicated. It starts with recognizing that everyday health problems happen in everyday places: kitchens, garages, backyards, and workshops. Cuts, burns, dehydration, and sudden illness rarely happen in a hospital. They happen where people live and work. When something like this happens, the first response usually comes from whoever is nearby, and in most cases, that means a family member. The problem is that many households are not prepared for that moment. When a minor injury occurs, people often feel unsure about what to do. They may search online, ask someone nearby, or simply hope the problem improves on its own. This uncertainty can lead to small mistakes. A cut might not be cleaned properly. A burn might be treated incorrectly. Early signs of dehydration might be ignored. These situations are rarely dramatic, but they are common, and this is exactly where survivalists focus their attention. Instead of assuming help will always be available immediately, they prepare for the possibility that they might need to manage a situation temporarily on their own. One of the first things survivalists learn about home medical care is the importance of basic first aid knowledge. Simple skills, like stopping bleeding, cleaning a wound, or protecting an injury, can prevent complications while waiting for professional care. These are not advanced medical techniques. They are basic responses that anyone can learn. For example, controlling bleeding is one of the most fundamental first aid skills. Many people panic when they see blood, even if the injury is relatively minor. But understanding how to apply pressure and protect a wound can quickly stabilize the situation. Another area survivalists pay close attention to is wound care. Small cuts and scrapes are extremely common, but improper care can lead to infection. Cleaning the wound properly and protecting it during the healing process can make a significant difference. This type of knowledge is simple, but it is often overlooked until it becomes necessary. Hydration is another area where basic awareness matters. During hot weather, illness, or physical activity, the body can lose fluids quickly. Survivalists often study the early signs of dehydration and understand how to respond before the situation becomes serious. Recognizing symptoms like dizziness, fatigue, or dry mouth may allow someone to correct the problem before it escalates. Another concept that survivalists often emphasize is preparation. Instead of reacting to problems after they happen, they try to prepare their households in advance. This preparation usually begins with something very simple: a basic first aid kit. Bandages, gauze, antiseptic, gloves, and other small supplies can make a big difference when dealing with everyday injuries, but having supplies is only part of the process. Understanding how to use them is equally important. A well-stocked kit is useful only if someone knows when and how to use the items inside it. That is why survivalists often combine supplies with knowledge. Many people in preparedness communities read practical medical guides, study first aid manuals, or take basic training courses. The goal is not to become a medical professional. The goal is to understand enough to respond calmly when a situation occurs. Another important lesson survivalists learn is recognizing limits. Not every medical situation can be handled at home. Severe injuries, serious infections, and complex medical conditions require professional treatment. Preparedness does not mean ignoring doctors or hospitals. Instead, it means understanding how to stabilize a situation until professional help becomes available. This mindset changes how people think about medical knowledge. Instead of seeing healthcare as something that only happens in hospitals, survivalists see it as a shared responsibility that begins at home. Small actions taken early can sometimes prevent problems from becoming larger. For example, recognizing early signs of infection or dehydration may lead someone to seek help sooner rather than later. This type of awareness can reduce panic and improve decision-making during stressful moments. Another interesting aspect of survivalist thinking is how they approach learning. Rather than relying on scattered online advice, many prefer structured sources of information. Books, training manuals, and organized guides make it easier to review information and understand how different health situations connect. A structured resource can explain symptoms, outline basic response steps, and clarify when professional care becomes necessary. this kind of organization helps people learn gradually instead of trying to absorb information in the middle of a stressful moment. The key insight behind survivalist medical preparedness is surprisingly simple. Most emergencies are not dramatic disasters, they are small, everyday problems that happen at inconvenient times. A cut while cooking, a burn from hot oil, dehydration during a heat wave, a child feeling sick late at night. These situations are common, and the first response almost always comes from someone at home. When people understand basic first aid, recognize early warning signs, and keep simple supplies available, they are better prepared to respond calmly. That preparation does not replace doctors, but it can make the time before professional care arrives safer and more manageable. In many ways, survivalists are simply applying a practical principle. Responsibility begins at home. Knowing a few basic skills, keeping simple supplies ready, and understanding common health situations can help households handle everyday problems more confidently. Preparation does not require extreme measures. Often, it begins with small steps: learning basic first aid, organizing a simple medical kit, and becoming familiar with common symptoms. These steps may seem simple, but they can make a meaningful difference when something unexpected happens. If you found this discussion helpful, consider subscribing to the channel. Here we explore practical health and preparedness topics and explain them in clear, simple terms. And if you want to look deeper into the type of medical preparedness guides mentioned in this video, you can also check the link in the description. It leads to a resource where you can review the details and see how these systems organize practical home medical knowledge.